This side-by-side comparison shows the actual stakes of tooth replacement. On the left is a successful, pristine implant, which achieves a 98% success rate. On the right is a failing implant, suffering from bone loss, a condition called peri-implantitis. While aggressive marketing campaigns often promise cheap, one-day fixes, ignoring the medical requirements leads directly to the scenario on the right. A successful result relies entirely on a biological process called osseointegration. A dental implant isn't a mechanical installation, like driving a screw into a piece of wood. It is a fusion process. Your living bone tissue must literally grow, weave, and lock into the microscopic threads of the metal post. You cannot negotiate with human biology. Genuine osseointegration requires 3 to 6 months to fully solidify. Rushing this timeline has immediate physical consequences. If a permanent crown is placed and subjected to heavy chewing forces before the bone has fully integrated, the implant will loosen. When an implant fails because the preoperative steps were skipped, the financial damage compounds. You now have to pay for the removal of the failed hardware, treat the resulting infection, and often fund an expensive bone graft before starting over. This easily doubles your total out-of-pocket expenses. This creates a difficult position for patients. You want an affordable, fast tooth replacement, but you are navigating a market flooded with heavily discounted, conflicting clinic offers. The initial price tag on a bargain clinic quote is rarely the final cost. The true cost of an implant is the catastrophic penalty you pay when you skip the mandatory medical, diagnostic, and lifestyle prerequisites. Hitting that industry-standard 98% success rate means actively choosing to sacrifice short-term convenience. You have to respect the biological rules of integration. This biological reality dictates a strict 3-phase sequence. We start with Phase 1, diagnostics and the health foundation. Your mouth is tied to your systemic health. You have to disclose your full medical history to your surgeon. Uncontrolled diabetes, autoimmune conditions, or medications like blood thinners and bisphosphonates drastically alter your body's ability to heal and must be managed before surgery. If you have active gum disease or severe tooth decay in adjacent teeth, placing an implant is like building a house on a swamp. Rushing into the surgical phase without clearing these conditions allows existing bacteria to migrate directly into the new surgical site. That migrating bacteria triggers peri-implantitis. The infection rapidly eats away at the jawbone meant to support your new tooth, collapsing the foundation. This visual comparison illustrates the next non-negotiable diagnostic step. On the left is a standard flat 2D X-ray. On the right is a 360-degree 3D cone beam computed tomography, or CBCT scan. Standard 2D X-rays simply lack the depth required for safe surgical planning. A 3D scan provides the exact biological data your surgeon needs. It allows them to map the location of facial nerves, avoid piercing your sinus cavities, and measure your exact bone density to determine if you require a bone graft before the implant can be safely anchored. Taking the time to demand a 3D scan and pre-treat any existing oral infections pushes your surgery date back, but it completely eliminates mid-surgery surprises and prevents botched procedures. Once the foundation is secure, we move to Phase 2, execution and materials. This is where prioritizing the lowest price over clinical expertise becomes dangerous. The global medical standards for the implant post are pure titanium or zirconia, paired with high-quality porcelain or zirconia for the visible crown.
These materials are required because of their incredible biocompatibility. The human body does not recognize pure titanium or zirconia as foreign objects, which is why the bone is willing to fuse directly to them. This comparison matrix highlights the specific corners cut by discount options. Bargain clinics often substitute pure materials with generic, low-grade metal alloys that risk rejection, and cap them with visually obvious, cheap acrylic crowns that wear down quickly. You have to interview your dentist. Ask exactly what brand and material of implants they use. Ask to see the long-term clinical research backing those specific materials, and verify their failure warranty policies. Do not worry about being overly interrogative. A highly trained, reputable implantologist welcomes these probing questions because they know their materials and methods hold up to scrutiny. Paying a significantly higher upfront cost for an experienced surgeon and medical-grade materials is a mandatory trade-off. It is the only reliable way to avoid both an aesthetic disaster and a functional failure. The final stage is phase 3, lifestyle and the healing reality. Once you leave the surgical chair, the success of the implant rests entirely on your daily behavioral discipline during the 3 to 6 month healing window. There is one habit that single-handedly destroys osseointegration: smoking. Nicotine constricts your blood vessels. This starves the surgical site of the oxygen and essential nutrients your jawbone needs to heal. Studies consistently show that this lack of blood flow makes smokers nearly twice as likely to experience implant failure compared to non-smokers. If you want a permanent tooth, you have to halt tobacco use entirely at least 2 to 4 weeks prior to surgery and maintain a strict smoke-free lifestyle for an absolute minimum of 8 weeks post-surgery. There is also a massive misconception about long-term maintenance. Many patients assume that because a titanium in porcelain tooth is artificial, they can slack on brushing and flossing. While the artificial crown itself cannot get a cavity, the gum tissue surrounding it is highly vulnerable. Plaque buildup around the base of the implant is prime real estate for a bacterial attack. Long-term clinical standards from institutions like the American Dental Association require you to use specialized implant floss, water flossers, and commit to professional cleanings every 6 months. Enduring temporary lifestyle friction, navigating nicotine withdrawal, and adhering strictly to a soft food diet during healing is the final, uncompromising input required to protect the money and time you've invested. If budget is an absolute constraint for you right now, it is statistically safer to wait and save your money. Do not attempt the procedure if it requires compromising on the surgeon's clinical expertise or skipping the 3D CBCT scan to save cash. If you have lifestyle risks and are unwilling to clear your medical history, treat underlying gum disease, or quit smoking for the required window, you are virtually guaranteeing that your implant will fail. We've organized these rules into a 3-part implant prep scorecard. Step 1, health audit. Resolve gingivitis, cavities, and stabilize systemic conditions. Step 2, interrogation. Demand 3D CBCT scans, verify titanium or zirconia, and check warranties. Step 3, commitment. Halt smoking, eat soft foods, and schedule cleanings. The reality is that a permanent, functional smile requires 4 to 8 months of patience. But by aggressively avoiding these specific errors, you secure an investment that yields a lifetime of function and confidence.